Welcome back, everyone. Mike here. Today we're going to be talking about part 2 of the low back pain prevention mini series that we have going on. Today we're going to be talking about flexibility and mobility. So what we want to do is we want to break down a little bit about how we want to define each of them, when we should be using them, when we should not be using them, and then also how they should both be used together. So first we're going to talk about flexibility. Flexibility is the ability to stretch a muscle, to lengthen, right? So we have lengthening. A couple of things we want to note of when not to do specific flexibility, which is really popular. Sprains, strains, and muscle knots. So if we think about sprains, strains, if we strain a hamstring, right? You're running or you're jumping, you strain a hamstring, a lot of our initial response is to stretch that muscle. Problem with stretching a strained muscle is that a strained muscle is typically overstretched already. So what we have is we have that micro tearing going on in the muscle fibers, and we're actually increasing that tearing effect by overstretching an overstretched muscle. So we want to actually stay away from stretching until the initial healing process has started, and then maybe move into a light stretching program. So this little diagram, we've got the red representing muscle fiber and the green representing the connection between the muscle fibers that allow them to slide back and forth. So when we have a stretch or a pulling action from flexibility, we actually pulling those two muscle fibers apart, creating more stretch in those connections as well. And oftentimes we can get a little bit of micro tearing when we're stretching outside of our normal range. So we want to avoid that if we have any strains or like tight trigger points or anything like that. Because if you think of like a rope and you tie a knot in a rope, if you were to pull on both ends of that rope, the knot gets tighter, right? So there's a couple of instances where we don't necessarily want to dive into flexibility. Flexibility is stretching beyond the current normal range that you have. That being said, if something is shortened from normal, that's when we want to increase flexibility. But we first want to focus on mobility, working into flexibility when we have those instances of chronically short muscle. Moving on to mobility. Ability to move is mobility, okay? So this also incorporates joints, hips, shoulders, any type of joint. Your ability to move is how mobile you are. So when we do mobility exercises, we're wanting to move more efficiently, move more freely, or move more without pain. When not to incorporate a lot of mobility is if you have a hypermobile joint. So if you're double jointed, if you can hyperextend your elbow, fingers and knuckles are often common things. You want to be really careful about too much mobility, because then you can actually overstretch tendons and ligaments that hold the joints together, and then now you're looking at increasing your risk for injury. So here in my diagram, here we have the normal muscle length, muscle fibers. Now, when we incorporate foam rolling, for instance, what we see is that the foam roller deforms around the muscle, but the connections between the muscle actually don't stretch and pull. What they do is they deform around the object, foam roller, tennis ball, what have you. And what that does is that allows us to break up any adhesive material like scar tissue inside the muscle fibers without actually stretching the muscle. So we focus on a bit more of a deformation, especially with an object. There's other mobility exercises as well that we actually move and focus more on the joints. Now, the mobility is staying within the normal range, but making that normal range move more freely. Both are necessary for maintenance. So when we talk about chronically short muscles, hamstrings for instance, we want to foam roll them, get them warmed up, start that adhesive breaking up process. You'll get much more benefit out of your flexibility. You won't incorporate pain, and you'll get better benefits increasing your flexibility range. So now what we're going to do is we're going to go to the mat. We're going to focus on a mobility and flexibility exercise that will help the low back, but we're not actually going to be targeting the low back specifically. So we'll just turn it over to the floor, and I'll see you guys on the mat. All right, so we're here on the mat. What we're going to look at is we're going to look at one particular flexibility exercises that really helps open up the hips and is located around the sciatic nerve, which a lot of people can have issues with sitting too long, flaring up that piriformis muscle, in which it starts putting pressure in and around that nerve and causes a lot of radiating pain down the leg. So we're going to focus on that. We're going to focus on one mobility exercise, which is also going to help open up the hips. And then in part 3, we're going to look at strength and activation. So with the Piriformis Stretch, I like to use the wall variation, especially if I know I have tight hips. What this allows us to do is it allows us to grade the stretch as we get more flexible. So what we want to do is we want a bit of a right angle with our shin down to our thigh, into our hips here. We're going to take the other leg and cross it over. Now, if you're feeling enough of a stretch as it is already, that's fine. If you need a little extra, you want to push your hips into the mat, apply light pressure onto this knee, and then hold for 30 seconds. By pushing into the mat with your hips and pushing on the knee, what this does is it really helps isolate right into that hip muscle, the piriformis muscle. So then you're just going to relax breathing, and you're going to hold for 30 seconds. As that stretch becomes easier, all you need to do is scoot your hips towards the wall. Again, leg over position, apply some light pressure, push the hips into the mat, and hold for 30 seconds. Now, the other hip mobility exercise that we're going to show today is called hurdle steps. This is a great one for help, again, opening up the hip muscles, activating and mobilizing the hip rotator cuff, as I call it, the deep hip stabilizers, just to make sure that everything is moving properly. So once we've covered that, then what we're going to do, like I said in part 3, is we're going to cover some activation and some strength exercises to help actually hold the load into the hips rather than into the low back, which is causing a lot of that low back pain. Okay, so when we're standing here, what we're going to do is, just as a hurdle step, you want to pretend that you have a fence about knee height. What you're going to do is you're going to stand nice and tall. You're going to elevate the knee, bring it over to the side, and drop it down like you're stepping over that invisible fence. You're going to bring it back up, inside, and down. Alternate legs, outside, down, bring it up, inside, and down. What this is going to do is help kind of mobilize deep into the hip socket, open up hip flexors, groin area, and it's going to complement the piriformis stretch by stretching out that piriformis, which is going to give us better mobility into the hurdle step. If you can't get your knee up all the way to hip height, just get it as high as you comfortably can, open it, and drop it down. And as time goes on, the more that you do this, the higher you're going to be able to lift that knee and open that hip up. Thanks for watching. Stay tuned for part 3, where we cover activation and strength exercise. See you soon.